What a nice crowd for a toasty evening outside. Good to see everyone. Thanks for joining. We have planned for you this evening a discussion to help people who have never put together abstracts or presentations, or maybe you've done it once or twice, but you need a little bit of dusting off, or maybe you have a lot of experience and you can feel free in that case to jump in and contribute to the learning of your colleagues. We have several wonderful presenters, and we're going to present this in four different sections. So we're going to talk both about clinical vignettes, and we'll talk about research posters, and we'll talk about oral or abstracts versus the actual poster for each of those vignettes in research. Since I see Dr. Chow there, yes, it looks like our first presenters are both here. So we'll go ahead and get started with the clinical vignette poster presentations with Doctors Chow and Abdel Latif.
Good evening, everyone. Is Abdel Latif? Here we go. Okay, all right. So I'm based at University of Maryland Medical Center Midtown campus, and Abdel Latif Ismail is one of our chief residents. And the way it works is, since I'm the program director, he's going to do all the work, and then I take the credit. So we have 15 minutes. Is that right? About 15 minutes.
15 minutes, please.
Yeah, and we're gonna just show some. We're gonna show some posters. Is that what you all expected? Is that okay? Okay. I'm gonna. I guess I have to share my screen. And what we're gonna do, we're gonna show you some sample posters, and then we're gonna get right. Get to work. Can you all see this? See this poster here?
Yes, we do.
Yes.
All right. Okay, and so we're gonna spend 3 minutes on this poster. I want to. Can anybody want to maybe either turn on their sound and tell us what they think, or you can put it in the chat, I guess. All right, we got 2 minutes and 25 seconds more. We got images or stretch. Yeah, hey, that's a great point. So sometimes people feel like they want to make the space, fill in that space with a picture, and they just stretch that picture out so it fills that space. And so that's not right. That was a great comment here, that the images are not proportional. That doesn't help, right? It's too crowded. All right. So this is a lot of words. Hey, anybody? So all right, we're not in favor of this poster. Dr. Ismail, you have any comments you want to make?
Yeah, hello everyone. My name is Abdul Latif, one of the chief residents at Midtown Hospital. I think, like, I agree with all the comments that were said. I also think that the colors like don't stand out. I feel like you can add a bit of like multiple colors here and there just to attract that attention rather than being all in like this blue color behind like the background of writing.
So not only at our meeting, but at large medical meetings, there may be 400 posters. If this was a poster that was at a national meeting, and there's 400 of these, and you're trying to attract people to come to you to look at your poster, I don't think very many people are going to stop and look at this poster. They're going to glance at this. They're going to say, "Oh my goodness," and then they're going to move on to the poster perhaps next to you. Okay, so the interest here is that we want to pare down the total amount of verbiage here. A lot of words, as Dr. Sapna mentioned. Okay, let's take this one down, and we'll go to the next one. See what you all think about this. Secondary adrenal insufficiency from intra-articular triamcinolone injections while on ritonavir boosted antiretroviral therapy. Okay, so that's an interesting topic. All right. Anybody want to offer any Look, there's no authors here because we purposely blank them out. Hey, there's a spelling error. Okay. If you were walking along and you saw this poster, would you stop and take a look?
I like that it has many images in it, so I might stop to look at the images.
So the thing I want to point out about this poster is that where do you start? You come up to this poster, and where do you start looking? How do you organize the flow of your reading of this poster? Do you start by looking at the learning objectives? Do you read that first box there on the top left? And then what do you do with those figures? Immediately go down to those cartoon figures. When do you look at those cartoon figures? And then these pictures of these patients with their eye blocked out. uh, when are you supposed to look at those? So your poster should have a chronology to them. Your poster should be that you start at one spot. Everyone who goes to your poster will follow the same sequence from the top, usually the top left down the column, then the middle, then the top right, and then down. So it's a now and that should be a logical progression, and but here it's a little confusing, right? You're not sure where to start, and once you start, where do you go? Uh, now, one thing that I've always tried to point out to folks: label your figures. So you say figure one, figure two, or table one, table two, and then in your text, refer to those figures, and that's or tables, and then that's when you know to go look at them. And if you if you if you if you don't refer the reader to a table or a text, then you wonder what is the need for that figure or that text or that table. Um, okay, any other comments here on this one?
I think that even though it is less wordy than the one prior to it, but I think it is still too wordy. I would cut down on the like at least the case discussion part, make it a bit shorter.
I would say that I do like the bulleting, but then you'd need to keep it short still. I would agree with our chief resident here.
Yeah, good. It's still a little hard to read, right? Even though it's bulleted, it's a little bit dense, a little bit hard to read. And okay, good. That's a great comment. All right, let's take this one down. Okay, and we'll go to um, let's see this one. Okay, things are not always what they seem. Oop. Sorry. Well, okay. All right. Comments here. Nice title. Yeah. Hey, spend. That's a great comment. You spend a little time try and think up a catchy title for your for your poster. Um, sometimes a you gotta be careful. Sometimes it can be catchy or corny, or it can put people off. But just be thoughtful about it. Spend a little bit of time trying to find a title that will intrigue people, get them interested. Okay. There's a comment about the sections. There's the spacing. So there are a lot of pictures here. I guess this gastroenterology poster, and GI people, they like pictures. And but uh, in general, you would organize your poster this way. You would uh, put the put some case description on the left side. Then you put posters. I'm sorry. You post images, EKG, um, uh, the pathology, sort of in the middle, and then you put your discussion and conclusion. The, usually there's a usually there's a goal. There's a goal for your poster. Why do you do this poster? What is the purpose of it? Um, the poster is supposed to change practice. So someone comes to read your poster, and they're gonna look it over. They'll mull it over. They'll think about it, and they're gonna go home and they're gonna change their practice because of what they learned from reading your poster. And that's the goal. And so you might want to help people with that. And you might you might put what they call it, a take home point. There's a little box, take home point. And when you go home, think about this. And I'm not sure exactly what this take home point is here. They're trying to make a point that hey, this is an unusual case of gastric cancer. Well, okay, well that's nice. How does that affect my practice? How is that is that game changing? Um, now, this is a this is a complex. I guess it's a fairly complex clinical course. One thing that you might see people do is that they might have a timeline along the bottom where it can help the reader follow the sequence of events. I'm sure you've seen that. That's a technique. Hey, by the way, Colleen, keep me honest in terms of the time.
You have just under 4 minutes.
All right, so we're okay. Emily, let's hear some comments about this. Dr. Cool wants to make a teaching point about the sensitivity of paracentesis. She's always trying to teach us something. Dr. Ismail, you have any other comments here?
Yeah, Dr. Chow. I think since, like you mentioned, in big meetings, audience can be overwhelmed with the large number of posters, and they will be walking like among hundreds of posters. I would like to have like a big section where there is like a conclusion. Sometimes I like to keep it in a central place where they're just like it will be the first thing to attract their attention, and then they would rather like read the poster or not. And I saw that it helped with that, with dragging the attention towards my posters.
Okay. Now, in general, the rule of thumb is you use the same font throughout the poster. You use the same size font throughout the poster. Well, what I mean by that is the titles here, like the stuff that's in red, you keep that the same size, and then the text that's in black, you keep that the same size. With the exception of references, you can make the font size of the references much smaller, and you can usually hide that in the bottom part of your poster. The references are there just for the nerdy people who want to know about references. The take home point is more relevant. Let me just show you one last poster.
Just keep in mind you have under 2 minutes and I'll cut you off.
Okay. All right. What do you think about this poster? Yeah. Uh, I wasn't a big fan of this. This resident showed it to me. I wasn't a big fan. But he insisted on doing this. He insisted on putting the take-home point in bold, huge letters. This big box in the that's red in the center. I mean, you can't miss it. Even if you're driving by in your car, you can't miss this. And he thought that this got him he presented this at a national meeting, and he got a lot of positive feedback on this. I'm not saying this is a a recommended technique, but something to consider. At any rate, he put the take home point right up front, and then hopefully you're intrigued, you're interested in that take home point. You're going to scratch your head and say, "Gee, I want to learn more about this," and then you dig into the poster and get into the meat of it. So I thought this was interesting. You notice that he does not have references. I think that's a error here. He needs to have some references. That's something that's an omission. Okay, we're up. Dr. Ismail, you have any last comments?
I think you covered this comprehensively, Dr. Chow. Thanks.
Okay, I think we're at the time.
Good. That's perfect timing, actually. You guys are amazing. How polished. That's wonderful. Well, thank you both to Drs. Chow and Dr. Latif. We'll have time at the end for questions so we can circle back on this topic, of course, but we want to make sure that we cover all of our 4 presentations, at least briefly. So we'll move on then next to research abstracts. And we have the pleasure of having Drs. Janaki Deepak and Dr. Rachel Hall present that topic.
So actually, Rachel is going to present and Janaki Deepak is going to take a back seat.
So we will go ahead and get started. So this is for abstracts, specifically for research abstracts. So just going to go through a little bit of the kind of pieces of all of this. This is just a statement about abstract eligibility, making sure they're original, things that have been published may be eligible if they were just abstracts. And just remember, if you present it here, might mean you can't present it elsewhere. Make sure your program director is signing off on everything. So as far as research abstracts, we've got a couple examples that we're gonna look at as well, just to kind of show you guys what you're looking at. And mainly this is gonna be, you're giving us the who, what, and why of what you did. And kind of also making sure you work in kind of why people should care about your research. So why was it important? What kind of were you really looking at? What is there some kind of nuanced topic or unstudied topic that you were exploring? So this is just an overview, and then we're going to go through pieces of this and another abstract. And just kind of remember, this doesn't have to include everything that's going to end up on your poster. This is just kind of an overview to introduce what you're doing. So parts of your abstract, so purpose for study, a simple statement of the methods, a summary of the results that's going to support what you are going to say in conclusions, a statement of your conclusions, and then can kind of modify that if needed. So the very first section is just title and authors. This is just kind of formatting. So your title, keep your title brief, state what your content is, and try to make it engaging or pull interest. That's what's going to end up at the very top of your poster, your presentation. So that's what people are going to see and what's going to kind of trigger them to come look and want you to tell them more about your presentation. The presenter should be listed first in the authors, and you have your list of authors. You've got your authors' institutions, city and state, and then including their ACP status, if applicable. Your introduction, so information about the aim of your research. So you're going to give background on whatever the topic was. So these were from 2 different abstracts. One of them was the one we saw previously on the right, and they talked about, obstructive sleep apnea, why this is an area that we need to study, why they picked the specific population they did. The other is talking about rheumatoid arthritis and giving a little background on the specific kind of area they looked at when they did their meta-analysis. You're kind of introducing what topic you're looking into and how you're going to approach that topic. For methods, just kind of a brief summary of what you did. So specifically looking at study design, was it retrospective? Was it a meta-analysis? Was it prospective? What interventions were done or what specific outcome was being looked at? How your data was collected or where it was collected from, and then specifically what you used to analyze that data, and what endpoints you were looking at. So you can see these were the two examples from the two different abstracts. And then results. So you want to include the data. So if you look at both of these, they'll look at, one, they looked at the 17,570 service members. They talk about how long they followed them for and the specific outcomes they analyzed. The other, they looked at these 659 publications, 13 RCTs, how many patients were included in that full analysis. So really showing what your population was, and how that was followed. And then the outcomes of the data analysis, including their statistical significance. So this is going to be your major outcome points. So for, OSA, they looked at these different ones, and you can see they included their HR and their confidence interval for all of these. And in the meta-analysis, they included their relative risk and their confidence interval for everything. And then for conclusions, you're going to state your findings. This is a really kind of short, just statement of findings, not as much going into a full discussion. That's what you're going to do in your final presentation. So for the one where they were looking at the JAK inhibitor and methotrexate, there was no increased risk of malignancy when compared, no increased risk for death. And then for OSA, they did find a higher incidence of OSA among these injured service members. They pull some of that data back compared to uninjured. And then they kind of make a brief statement about the association appears to be driven by, traumatic brain injury and long-term mental health. So just very brief kind of statement of findings. This is just a brief statement about abbreviations. So if you're using any kind of abbreviations, they need to be approved. If they're non-standard, then the first time you use them, write out the entire thing, put your abbreviation at the end, and then you can use the abbreviation through the rest of your writing. Try to use generic drug names, and use metric standard units of measure. So these were the two abstracts, if you guys want to take a look again, having all of the kind of pieces to them. So just remembering, you're going to have your introduction or background, your methods, your results, and your conclusion. Like I said, each of these sections is really just highlighting the major points of those to try and talk about the who, what, why you did what you did, and why it is, relevant. And then you'll expand on all of these further in your final presentation, as we'll talk about. Any extra comments, questions about these?
So Rachel, before we move on, it's in research abstracts, one of the big things you're going to notice is every society is different about the abstracts. So certain societies are not going to allow you figures and tables. So if you're hung up on a figure or table, make sure that your specific society that you're submitting to is going to accept it in the research abstract. And here is where, and I was told this, your title should be as short as possible. So if I look at the JAK inhibitors and methotrexate combination versus the obstructive sleep apnea after traumatic injury, definitely the obstructive sleep apnea after traumatic injury immediately catches your eye. So even though we have to look at this and it's a big topic, try to see how you can best do it, because in a lot of societies, when you're submitting abstracts, even the title has only a limited number of words that you can use. So that is an important thing. The introduction, a line or two, always like and then you can do a little bit more. The methods are really important, and Dr. Weisman is going to kind of parlay into this a little bit more when he talks about the actual poster presentation. And people are looking for the results section, right? You want the results section. This is where you really are not, this is not where you are doing sentences. You can like do short bursts of like words and make sure that you don't have to say there is something like that. Like make it short, because your abstract words are very, very limited when you're presenting to all the societies. But the results are important, the conclusions important, and sometimes way to move forward, right? Like what are the next steps? They're looking for that too. So those two things are extremely important. And yeah, that's just something I wanted to say.
Thank you. Anybody else have any comments about either of these? Questions about anything?
Rachel, I was going to actually ask the question a little bit. Dr. Deepak just answered it, though. Whether can you weigh the pros and cons of when you submit the abstract, putting data in figures and tables right in the abstract versus prose? And I wonder if you had any other thoughts about that.
Yeah, I think particularly for the ACP, you may want to just go with prose, just because of the space that you have on the abstract. It would be a lot. It would take up a lot of space to include, a table or a figure. And you're going to be able to go into those further. When you do your presentation, that's when people are really going to be looking for your figures and your tables, and those are going to draw people in. So.
Another thing I would mention is, and I'm comparing these two abstracts. The one on the left, the introduction looks a little long to me. You got to have a little bit of a balance, and I'm big on limitations, and a lot of societies are as well. And so, listing your limitations. Now, this obviously your time, your space is limited, so that's why you have to have a nice division between the introduction, methods, results, and conclusion. But I typically like to see, in fact, I'm on a research committee, and if we don't see limitations in the conclusion, that's a strike. That's my personal thing. I've seen that, and I don't know if anybody else has any comments on that.
Yeah, I mean, for me, that way to move forward or next steps includes a limitation, and that is a big ask. Like if we don't see it, that is something that we kind of do not look at it as much, because that is the most important thing, because there has to be some kind of limitations of each study. And it's very difficult, right? When you're submitting the ACP abstracts, it is such a short space, and it is so much you have to say, and there's so much more to write in a research abstract. And unfortunately, given that we don't have figures and tables, there is a lot of words, but it's very important. And I would say when you do it, highlight each one of those introduction, methods, results, and conclusion. And remember, those headings do not count in your word count. Very important thing to remember. Any of those headings do not count in your word count. So that is something you need to remember too. So don't fret too much about the words in the heading.
And also, when you have a lot of results, you don't have to list all the results. I think that's the most pertinent results that you're trying to tell the story through, you're trying to get the message through. And certainly, there will be a manuscript, hopefully, that will follow this up later, that would have much more detail probably in there. Because I'm again looking at the kind of the symmetry here on the right. There's a lot of data there. Not entirely sure it's all pertinent, or as pertinent as some components.
Yeah, I agree. I think that's there's two mortal sins that I think about with abstracts. One is not making it fit the space limitations. That's like a mortal sin. That's a hard no for me. You got to make it fit in the space you're given. You're told to keep it in there. So make sure you do that. And then the other one is when people try and just cram in way too much, and you don't have a punchline because you're trying to explain absolutely everything you found. So your abstract should really make a punch with 1 or 2 points. Your poster's going to be a little bit bigger, and you're going to be able to put in a table or something like that where you can make 3 or 4 points. And then your paper is going to have a very detailed paper, and you're going to talk very detailed table that's going to describe everything that you found, and you'll have a really rich discussion about what that means. So I think if you think of those as sort of nesting dolls that get bigger and bigger. But any last points on this before we move on to the research poster? Well, thank you both, Drs. Deepak and Hall. We'll go ahead and switch over. We have Drs. Weissman and Josham to talk about the research poster now.
Okay, great. Hi, everybody. I'm Shakti. I'm one of the chief residents at MedStar Baltimore, and I'm here with Dr. Weissman. He's our associate program director. And we're going to be talking about effective research posters here. So here we have a slide that shows how to make an effective poster presentation. And this kind of just goes through the different sections you will see in your posters. So starting with, and a lot of people don't really do this anymore, I've seen, but you can actually include the abstract, truncated version of the abstract in your poster as well. And we'll kind of expand on each of these sections a little bit more in just a couple of minutes. But you can start with the abstract, and then the next thing you want to do is include an introduction or background. And this is going to have kind of the purpose of the study. Why did you do the study? And this will also include your research question and hypothesis as well. Typically, the next section that follows is going to be your methods and how you did the study, followed by the results. So what were the results of your study? What did you find? And here you can actually include tables and figures if pertinent to kind of make that a little bit easier for the readers to take in. The next thing you can have, and usually kind of like Dr. Chow mentioned, in the middle of the poster, you can have tables and figures, and then you'll have the discussion. So the discussion is what did those results mean to you, and you kind of discuss the results a little bit more in detail. Finally, you'll have the conclusions. What conclusions did you draw based on the results that you found? So kind of delving into these sections just a little bit more. Why is the abstract important? Well, it's the first part of the poster that the readers are going to see. So it helps the reader really understand your research at a glance, and it's going to be just a summary of your entire research question, the methods, and the data that you found, as well as your conclusion. So it's nice to have that at the beginning of your paper if you have the space for it. The next section would be the introduction. So really, why are you doing this study? What's the background? A little bit of literature review here would be helpful. And you can use bullet points to kind of keep things as brief as possible so that it's not quite as wordy. The next section would then be the method. So here you want to give enough information to allow somebody else to be able to replicate your study. So how you actually did the study. And Dr. Hall kind of went into this a little bit more just a little bit ago. But here, when you're doing the posters, I think it's a good idea. You can actually attempt to use schematics or flowcharts to try to make it a little bit easier for your readers to digest the information, because this is going to be a little bit of a denser part of the poster itself. So just to try to keep things a little bit more eye-catching, you can use flowcharts here, I think. The results section here you will see the use of tables and figures, and only really use these if they make your results easier for the reader to understand. So it's not something that last thing you want is to have a poster that just has 8 tables on it with a bunch of numbers that you don't really understand. So it's helpful to have if it simplifies the results. And then the same thing goes for figures as well. And then each of these should have legends that go along with them and should be labeled, figure 1, table 1, etc. Next, what do you think the results mean in the discussion? And like Dr. Weissman mentioned earlier, here's where you can really go into, the strengths as well as the limitations of the study methods as well. And finally, the conclusion should directly relate to your study's research question, and it should be, what are the conclusions that you drew from your results? Here, I would, say that it's helpful to have kind of like the take-home messages that were mentioned earlier. You could use this section and kind of highlight it, so you'll have a different color in that rectangular box when you've kind of like divided up the sections to really highlight the take-home points. And this should just be 2 to 3 big points. What do you want to leave your readers with? And then finally, you could have references at the end. Just a few words here on the overall presentation of the poster. So you want to have your institutional logo, start with the heading or the banner, include the authors and affiliations as well. And then regarding the font type and font size, you really want this to be easily visible and easily legible for the reader. So they should be able to read your poster at least 3 feet away when they're standing 3 feet away. So the minimum font really in this section should be about 24 and up, but ideally 30 and up would be the easiest for somebody to read the font. And then the font type is not really I wouldn't say this is not really the time to experiment. Like when you blow the font up and put it up on a poster, should be easily legible. So Arial is a good one to go with. And then spell out all acronyms or don't use them as previously mentioned as well. Tables and figures, we kind of went over this. Really, you should only use them if they present your data more clearly and make it more easy to interpret than just having words on there. And each figure or table needs a legend, and you should be careful with colors. So typically a light background with dark font is kind of the way to go. And then you really need to prepare for the oral poster preparation as well. So, know your audience to whom you're presenting, emphasize your take-home points, and it's really, really important to practice. So practice with your colleagues, your friends, and anticipate questions. Have them ask you questions and really know the poster like the back of your hand. You should be able to really present your poster within 2 to 3 minutes. And then you can also have handouts for references. I just wanted to leave you with some final thoughts before Dr. Wiseman goes into some examples here. So this is a visual medium, so less text if possible, more meaningful figures, clear font, and smart use of colors. You can bold and emphasize important, text and keywords. Your take-home points should be simple and easy to view and usually larger. I would say maybe a little bit larger than the rest of your text. And some practical tips here is to read the conference guidelines so you know what the formatting requirements and poster size is for the specific conference you're submitting to. Also, you can leave your contact information. I would say, what I've seen people do recently is to have like a QR code linking to their email address and their information, or you could print out business cards and, of course, practice your oral presentation. So I will these are our references. So I will kind of review some examples here. If Dr. Wiseman, you could take over. I'll keep moving the slide.
I appreciate that. Yeah, so we thought we'd get these are actual posters that were presented at the ACP meeting over the years. Some good examples and some not good examples. And hopefully you may be able to recognize this as a not good example. By the way, I had to get permission for everybody. Don't worry, these were given permission towards, and I think I participated in this one. So, on face value, your initial impressions are, gosh, this is wordy, right? This is wordy. Tables are too much. And again, when a poster, you are limited with size of the poster. And so you may not have to present all of your data. And that's why they have the QR code can link to more information if a audience member was interested, rather than having everything on your poster. And so I'm big on bullet points. I like bullets as were used in this particular example. However, I think, and if I don't recall correctly, but I think this font size is maybe just a tad on the small side, especially when we get into the tables, which you have to squint at almost. I'm looking just about a foot away from my screen here, and I'm having difficulty seeing them. So this is typically the layout though that I typically see. There's a lot of nuance to posters, a lot of different ways and creative ways to make them. Traditionally, this is kind of the layout, the introduction, the method section. I do kind of like, especially when if you can put a flow chart into the methods, this may be helpful here. to kind of explain how patients or whoever matriculated through the study, highlighting the inclusion-exclusion criteria, primary outcomes. I think that was probably reasonably well done here. I think the big downside to me on this particular poster is the presentation of the data itself. And I don't know if anybody can please unmute and give a comment here. The color selection, not good. Nothing is standing out to me at all. Having a really difficulty kind of, focusing myself on the important data points, and just not very eye friendly or catching at all. The discussionary point, also broken up into bullet points there, highlighting the few key elements of the study findings. So in the end, this was actually a good study. It got published in a very good journal. And in the end, we were kind of happy with the study, just not happy at all with how this poster turned out. This did not win that particular year. Let's keep going. We got a few other examples here. This is a meta-analysis that I thought was good to bring to bear, because a lot of our residents work very hard on putting a meta-analysis together. It's an incredible amount of work that goes into these. And this was an interesting meta-analysis looking at colchicine and coronary artery disease, looking at randomized trials and putting them together, a good clinical question. I think they fell short, too, on this particular poster about presentation of the results here, primarily, again, coming back to that. That's not well balanced. I do, again, like the bullet points. I think that's helpful. I think, we want to put a lot of information on these posters, and I think less is sometimes more. So try to really think about every word that goes on the poster itself. The less words, typically the better, the more clear things become. And I typically like the main outcomes data in the center of the poster. So here, the forest plots are off to the right. They chose to put the study researches, in particular studies table in the center. I probably would have had that oppositely done. I would have liked to see front and center the hard work that was done for these really cool forest plots, and seen that maybe a little bit more blown up. And again, you don't have to put all the necessary outcome information, just the key elements. So that little blurb above the middle table may be a little long. I have no idea if we're on time or not. Colleen,
You've got just 2 minutes.
2 minutes. Okay, let's go to good examples. Okay, little better example here. Again, I would just highlight here with the colors of the table, or a little more eye pleasing, little more. I can read this now. I can see the color contrasting is good here. Go to the next slide if you don't mind. This one was a first prize winner, I think about 3 years ago. It's a nice study. It's a good question. It was well presented. The poster itself is fairly easy enough to look at and kind of discern with your own eyes what's going on here. I like how the main data is in the center of the poster. There's some pie chart figures off to the right, but they're nice and colored and clear. So this was an interesting study using IgG and immunocompromised hosts, primarily transplant patients who came in with pneumonia, and looking at outcomes versus those that did not get IV IgG. So it was a cool little study, and asked a very straightforward question, and even though it was a retrospective observational study, it caught the attention of the judges. Maybe let's go into one more. Maybe one more. Again, this one I think won about 2 years ago. And again, the presentation of the data looks reasonably good. I like the spacing in between. The centerpiece, a little busy, I think, in table 1, table 2, but I can read it and I can make it. I can understand it. Not too bad. And then a nice ROC curve presented there, and then the conclusions and such. So I thought this one had a QR code, but I guess it doesn't. But nonetheless, a reasonable layout. I think what all these boil down to is good presentation and clear, succinct storytelling, and taking your audience through it.
Thank you so much to Doctors Wiseman and Gautam. All right, and then our last section is on the clinical vignettes abstracts. And so we have Doctors Kuhl and Cyram.
Hi, everyone. So Dr. Keel and I are going to just kind of be talking about, how you can write up your clinical vignette abstract. You did see some posters as example, but we want to go over, picking a case and writing about that, and also answer some frequently asked questions around that topic. And at the end, Dr. Keel will go over some of the abstract examples for you guys to see. So I'm going to go ahead and share my screen. I'm Jayashree. I'm one of the chief medical residents at GBMC in Towson, and Dr. Keel is also one of the inpatient faculties here at GBMC. So I'll just get started with the topic. So the first thing when, we talk about where clinical vignettes came into existence is that prior to any kind of formal medical, education, clinical vignettes used to be one of the oldest and most familiar form of medical communication before, scientific journals existed and medical literature existed. So a lot of initial patient observations regarding, new disease conditions or even some atypical presentations of, other existing disease conditions were first presented at that time. However, it's important to remember that there are some rules when it comes to writing abstracts for both format and, keeping it kind of short and concise. So what is a clinical vignette? So these end up being concise case-based descriptions. They don't have to be just one particular patient case. It can be a series of patient cases that either illustrate, a new disease condition, or as I previously mentioned, any prominent or unusual clinical presentation of an established disease. So as I said, when you're writing a clinical vignette, one of the important things to remember is that it needs to be a concise summary of just pertinent patient history, physical exam findings, lab data that you're seeing, and then kind of putting together management. And the important thing with any kind of abstract is making sure that you have a take-home or teaching point. Now, the most difficult question, that we come across, the dilemma that we have is deciding if, when you encounter a patient case, we always think about the question of whether this is a case that's worth submitting. So, as you might already know, a rarity of a disease condition is probably one of the most common things that we use when we are considering whether we're, meeting the criteria for worthiness. But again, as it says, the disease is rare, so not all of us have the opportunity to come across such disease conditions. So other kind of cases that need that worthiness would be, as I said, a very different presentation of an established disease, or sometimes even the lesson that it teaches. So if your case, your patient case is able to increase awareness of a particular condition, or if there are suggesting any diagnostic strategy which has never been probably established in the past, or if your patient case has, is able to provide a cost-effective approach or change in management, or sometimes what we call twists in the story, meaning like that disease condition presented with a very unusual complication. But I think with regards to whatever case that you're considering to put together as a clinical vignette and write an abstract, it's important to think about the message or the lesson that that case can basically deliver. Now, some of the frequently asked questions when it comes to submitting your abstracts for clinical vignettes is, can I, use the same vignette for different meetings? The answer is definitely yes. I think the important thing to remember is that each conference or like society meeting might have their own rules. So it's important to review them to make sure that, you're not violating them. But when it comes to ACP, you would recognize that you're able to submit any abstracts that you're using for your chapter meetings, which you can submit to your national conferences and, other society meetings. Now, we've talked about the title quite a bit with when it comes to both research and your clinical vignette, be it abstracts or posters. The important thing is that your title ends up being kind of the summary of the case that you're describing. And so it's important to be kind of relevant, but at the same time be innovative, so your catching the reader's attention. So instead of usually having a very long, descriptive title, it's nice to be short, nice to keep it short, but at the same time, something that's catchy, that's pretty much interesting, that brings the audience's attention to your particular poster when you're actually presenting. Um, the discussion about authorship of, case reports is one thing to think about. Previously, the idea was that any individual who's been involved in the management of a patient ends up, automatically qualifying for being an author for a particular case report or a clinical vignette. But then that's no longer the case. So one of the big things to remember is that when it comes to the order of authorship, the person who ends up contributing most to the intellectual content of that clinical vignette, definitely takes precedence. And then you go kind of in a descending order of who contributed the most, ends up being the first author, and generally the one who ends up presenting the essential abstract at the poster meeting when it gets accepted. Now, when it comes to the different sections of the abstract itself, it's pretty much the same or on similar lines as a research abstract. So you start with your title that, just puts together, a description of what your case is about, and then followed by author information in, the order of authorship. So your first author comes first, and then you kind of go down the line along with their institutional affiliations. Now, one thing to keep in mind is that obviously, if you have 6 or 7 authors in your as part of your abstract, then it kind of dilutes down the work that you've done. So, keeping it really short to 4 or 5 people would be ideal. Your introduction would be the next step, and your introduction goes over pretty much the background of what so far has been discussed about the topic. Try to keep it really short and concise, and you're essentially giving a brief background and why this topic is important and what you're going to be talking about. Now, case description, again, when you looked at posters for both your research and your clinical vignettes, you could see try to keep it in, very concise, just very pertinent to the case. So you provide a brief history, a physical exam, relevant lab studies, and imaging that you have, the clinical progress of, how things turned out. And I think as Dr. Colley mentioned, getting to know what ended up finally happening with the patient. And the next portion of your abstract ends up being a discussion along with your conclusion. So your discussion ends up telling, why some of the decisions were made and kind of what is important to take away from, the discussion that we had with regards to this particular case. And finally concluding with your take-home message or your learning point of what this case is trying to say and how can this essentially possibly change clinical practice. And then lastly, quoting references is also equally important. Now, what else do I need to know with regards to submission when it comes to abstracts? Just like, your research abstracts, all abstracts end up being reviewed and signed off by your program director. So definitely make sure, when you have a particular case that you think would be worthy of writing, talk to your mentor, kind of get an idea of how you can put everything together. Have someone review it. Definitely look to check for grammar, proofread it, and then submit it to your program director because they review it and make sure and turn it over to the society. And what format should you be using? We'll show you some examples of what the abstract submission form looks like. It's essentially a box within which you fit all the contents in. That doesn't mean that, if you have a lot of words, you're trying to squeeze everything in. So it has to be legible enough for people to read. And also, again, as I said, very concise. So try to keep your font anywhere, 10 or greater. And, use specific font styles that are most commonly used, like Arial, Times New Roman are the ones that are generally preferred. And you start with your title, you write your authorship details as well, and then each content ends up being really short paragraphs. I'm going to let Dr. Keel take over.
So excellent overview, Jayashree. So I just want to show you the form so that you can take a look at this and see this is typically the form we have used, and you will put in your institution, and there's a box that isn't large, but is adequate, more than adequate, to give an example of the case and to give the title. Your name would come next, the introduction, a little bit of the case. Remember, you're not going to fit every single finding here. You're going to keep it to the pertinence, keep it to the key features, and then talk about what happened to the patient, and then a 1 or 2 line conclusion at the end of why this case was presented, why was it important for you to do so. So here, you could go to this slide where you can read it a little bit better. So we just kind of made it larger for you to be able to see. Abbreviations can be used. You just want to make sure that they are appropriate and standardized abbreviations, and you take a moment to show what that abbreviation will be, and then continue to use that through. And there's a little bit of an abstract checklist that has been floating around, but the number of copies needed isn't quite relevant, but the due date to remember who's going to be the presenting author. They will be the first author, making sure they meet the eligibility requirements for the meeting, because you may have multiple cases, but you're going to probably only be presenting one. So who is going to be the first author presenting that case at that meeting? And then I think we talked about the font and the size and keeping it short and sweet. And go on next. I think here's another example. This is a case of HLH, secondary to suspected SARS-CoV infection. So there's a little bit about HLH in the beginning, and then the case, and what did they investigate, what did the patient require, that's your and what happened, the course of patient care, and then a little bit the conclusion at the very end. So it just gives you an example. You're not going to tell me all findings, but you're going to tell me that they had sclerolicterus, hepatomegaly, they had certain findings. You're just focusing on those labs and findings and why they were important. And then certainly you can elaborate more in the poster when you get there. So I think we have one more poster here. This is Getting the Gist. So I like the title here. It's a little clever. Dr. Weissman likes it too. And it talks about the spontaneous hemoperitoneum with an unusual diagnosis. So talking about why GIST and how it presented, what's interesting about it in this case, and the complications that this patient went through. And then how did they finally make the diagnosis? And then here the discussion is a little bit longer because GIST is not something you see commonly. So you may want to spend a little more time educating people on this. And why this presentation's unusual, because intraperitoneal hemorrhage as a presenting diagnosis is not that common, and that's why this case was particularly more interesting to present. I think that's about it. We just wanted to let you know that there are other resources out there. ACP does have some specific resources that can be very helpful. So I think with that, we're done.
Yeah, it's wonderful. Everybody stay on time, which I really appreciate so much. So we have 10 minutes open for questions and answers. I thought while we were waiting for people to ask questions, I would invite the chief residents and the faculty who presented here, if you would pick 2 of your pet peeves and 2 of your standouts, gold star tips for people. So for example, maybe you're colorblind. And so your pet peeve is when someone has red, green on the same figure or something like that. Or your pet peeve is a misspelling or whatever. So if you can put those in the chat, we'll have kind of a little cascade of interesting little tidbits for things that like mortal sins and things that give you the gold star there. So for the remaining 9.5 minutes, we'd love to entertain any questions that people have. I'm actually on my phone, so I have a hard time looking for hands raised. But if you want to just unmute and jump in, or you can put your questions in the chat and I can read it out loud.
While we're waiting for that, as always, it says say a couple words. So know your audience. I think one of maybe my pet peeves if you're talking above your audience or just not to the audience who's in front of you. So what do I mean by that? So if you're doing a basic science sort of research and you're at a clinical conference, make sure you kind of make the link. Why is this important for us to know about? So make that link early in the, not don't wait it for the end. Get that out early.
Hi, good evening. I'm not sure if everybody can hear me.
Yes, go ahead.
Hi, yes. My name is Joy Day. I'm a internal medicine rotation medical student I'm a St. Matthew's student. I'm currently at St. Agnes. So my question is mainly, is there a specific order of trying to get the board together in terms of, do you start with your interests and getting the title? Do you start with research first to see if there's enough research before actually moving forward? Is there a specific way or order in terms of moving forward with going to make the abstract and everything?
For which kind of presentation? Are you looking for research, like formulating your question for research or for a clinical vignette?
For research. Sorry, I didn't make that clear.
That's okay. That's okay. It's just helpful so that our presenters know which direction it might be targeted. Would either of our, or any of the four of our research-focused presenters want to take that?
Just to clarify the question, so the question was about in what order do you
I think it started, I think.
get started? Yeah, so I think if that's a great question. So obviously you don't start with a manuscript. So at the point you have your data and you've gone through your data and you're looking at your finer points. In fact, I almost never make it an effort to go right for a manuscript right off the gut, because one, you want to present this at a conference, you want to get feedback on it, you can make things better based on that feedback. So definitely plan any research project that you do to present it at a conference, and of course that's going to probably start with an abstract, and that helps you get those words on paper. So that's a hard thing to do, but just start writing. And then that'll formulate, and hopefully you have a mentor that can help you edit your abstract.
And the other thing I would like to add to that is sometimes it can just be part of your project, right? Sometimes it can be one table that you did of the project or some sub-project that you really feel that this can easily go as a poster, as something preliminary, garner some data and get some feedback to bring back then to the further manuscript or paper or things like that, or even further studies, right? What direction you want the research to go. So even if it's a small pilot project, that's great for poster, right? You'll definitely get accepted for thematic posters. So don't let the number of your subjects be a limitation or small data be a limitation. Whatever is the data, it's okay to go for a thematic poster. So just write it up. You never know.
Okay,
I think sorry for interrupting. I was just going to say, I think a lot of times, both for the clinical vignette and the research, actually, I think students and residents will agonize over finding something earth-shattering to present. And honestly, I think, unusual diagnoses are interesting and that's really cool. And I learned something, but I personally actually prefer a more common diagnosis that had an unusual presentation or something that I'm actually likely to encounter in my lifetime. And I'm going to read your poster and learn from that and then maybe take better care of somebody at some point. So the research can be actually something really small. It could be a negative result. All that continues to give us new knowledge about that field. And the clinical vignette actually doesn't have to be like earth shattering. It can just be a little twist. If you feel like you saw a patient and you learned something, you had to look something up, or you're puzzled and you learn something, chances are somebody else is going to learn from that too. And that makes just a fine vignette.
I just wanted to say one thing. Somebody in the chat asked about permission from patients, and absolutely, you must get permission from the patient. And your institution probably has some kind of a form or something that you need to fill out or document that permission. So please do so. That is incredibly important. In my experience, most patients are very willing to share, but again, you do need that permission before you do so.
Yeah, on the back end of that too, a lot of journals actually have a very specific consent form these days. So think about that too when you're thinking about which journal is a case report. Case report can be very difficult to find a publishing journal, but there's some good ones out there.
Yeah.
And I think we had a list that went out last year, if I'm not mistaken.
Yeah. There was a list last year. Yep.
I thought I saw a hand, but now I can't find it. Oh, maybe I didn't. But someone in the chat had asked about how do you present your research during interviews. We do a separate workshop on residency interviewing, and that's a whole art on itself. But we have some program directors and former program directors here. I'll start by saying I think it's got to be pretty succinct. And that's another instance, as Dr. Weissman said before, to know your audience. So is this interviewer asking about your research because that's their area of research too, in which case they're going to want a little more detail. And that's a more challenging situation to present. Is this someone who's just saying, let me see if they actually got into their research and how involved they were. Tell me about your research, in which case you just need to be able to generally describe what you did, why you had this question, why it was interesting to you, how you came about to the conclusions that you found, and what you found. So it'll be a much shorter thing, and then open that up for anybody else.
Well, I just want to say that the creation of the poster, well, creation of the abstract is one thing, creation of the poster is another thing, and then presenting the poster is an art unto itself. And there's some great posters, but they're presented in sort of a I don't want to say boring, but sort of a way that's not very engaging. There's an art to it, and this is something that someone mentioned about rehearsing your presentations, practicing it, but also trying to engage the audience to whom you're presenting it to. And when people present a poster and they ask a question at the outset, have you ever wondered about this? What have you ever seen a patient with this? When they ask a question to the audience, it engages the audience and pulls them in. But just think about that as you're trying to think about how you might begin to put together your presentation of your poster.
Good. And I think someone mentioned this during their presentation, but QR codes are really a cool thing now. Back in my day, we didn't have such a creature, and you only got your poster board and what you could fit on that. But if you do have actually quite a lot of data that doesn't fit pleasantly on the slide, but you want to have it available kind of in your back pocket in case someone wants those details, having a QR code where someone can come up and snap a picture is amazing. Super, super helpful. So I encourage the use of those, particularly if you have fairly dense data that's not that easy to just kind of summarize, or people might want the details.
And
Well, we are wrapped. Oh, sorry.
Just to give a little bit more in that, you don't have to even put it on the poster. You can just print it out and have it next to your poster if you don't want it to take up space as well.
Yeah, doesn't have to be huge, Joe. Well, I hope everybody enjoyed this. This was wonderful. Again, I put in the chat the dates for our Williams Student Conference, which is on Saturday, February 15th. That's at University of Maryland Midtown. Beautiful facilities. There's poster, there's talks, there's Students' Dilemma, a little Jeopardy game. It's a really fun day. So join us if you can. There's also the conference for the residents, the Mulholland Muller meeting, which is on Thursday, May the 1st at St. Agnes. And again, all sorts of great presentations, poster competitions, you name it. It's a good time. So hope you can join us. Thank you everyone coming. Please join me in thanking our presenters. You guys did such a wonderful job. Drs. Chow, Dr. Latif, Dr. Hall, Dr. Deepak, Dr. Weissman, Dr. Gautam, Dr. Kuhl, and Dr. Sayram. Thank you all so, so much.